Hello, I'm Dr. Nasmani, and this is the first session of the concept bridge in pathology. There are similar sessions for entrance test also in the YouTube channel youtube.com/acpgmet. Environmental pathology, role of forensic medicine. Environmental pathology is most often encountered and diagnosed in a medical examiner's office, where forensic pathologists conduct autopsies in order to determine the cause and manner of death. There are 5 manners of death rendered in forensics: natural, accident, homicide, suicide, and undetermined. Natural, like myocardial infarction due to thrombosis; accident, like motor vehicle accident and falls; homicide, like gunshot, strangulation, stabbing, assault; suicide, like self-inflicted gunshot wound and hanging; undetermined, like remains unclear after thorough crime scene investigation. Only a forensic pathologist can determine the manner of death other than natural. Accidents. Accidental deaths are considered unintentional injury. The most common cause of accidental deaths are motor vehicle trauma, drug overdose, and firearms. Drugs and toxins. Toxicology involves analyzing body fluids such as blood, bile, urine for the presence of toxins or drugs. Toxicology is an integral part of the autopsy and may provide the cause and manner of death, like cocaine overdose. Tobacco use is the leading cause of lung disease. Tobacco smoke contains particulate matter like tar, irritants, carbon monoxide, and some 43 carcinogens. It inhibits respiratory mucosa cilia and is absorbed into the blood to exert its effects. Tobacco smoke is responsible for 30% of the cancer death and 90% of all lung cancer deaths, including second-hand smoke or passive smoke. Tobacco plays a role in causing ischemic heart disease, chronic obstructive airway disease, asthma, bronchitis, and stroke, including women who are older than 35 years who take oral contraceptive also, and for babies with low birth weight babies, and sudden infant death syndrome in children. Ethanol. Ethyl alcohol is the most widely abused legal drug in the world. A blood alcohol level of 80 mg per deciliter or 0.08 grams percentage is the legal definition for drunken driving. Ethanol is a central nervous system depressant which causes a relaxed feeling that can progress to decreased inhibitions and movement abnormalities like stumbling or ataxia. Chronic ethanol abuse leads to multiple organ pathology. Liver changes include fatty change, acute hepatitis, and micronodular cirrhosis. Brain effects include Wernicke-Korsakoff syndrome due to thiamine deficiency, which grossly present as hemorrhage into the mammillary bodies, and cerebellar degeneration. Clinical manifestation of Wernicke syndrome are ataxia, ophthalmoplegia, and short-term memory loss, although on a continuum, Korsakoff syndrome is a irreversible form of Wernicke's syndrome. Heart effects include dilated cardiomyopathy due to direct toxic effect of the drug on the heart. Ethanol causes gastritis and may cause pancreatitis. Ethanol abuse may lead to testicular atrophy in men. Ethanol consumption during pregnancy is not recommended because it may lead to fetal alcohol syndrome. It appears that acetaldehyde, that is a metabolite of ethanol, crosses the placenta and damages the fetus. Fetal alcohol syndrome has characteristic facies: small head, epicanthic fold, low nasal bridge, small eye opening, flat midface, short nose, smooth philtrum, then thin upper lip, and underdeveloped jaw. Fetal alcohol syndrome is the most common type of preventable mental retardation in the Western world. The amount of ethanol required to cause this syndrome is not well understood. Therefore, women are advised to refrain from drinking during pregnancy. The picture shows on your left side sample A, ethanol causing liver damage. Alcohol causes reversible steatohepatitis. Picture B on the right side, irreversible micronodular cirrhosis. Ethanol and aldehyde dehydrogenase. Ethanol is metabolized into aldehyde, acetaldehyde by alcohol dehydrogenase in the liver. Acetaldehyde is converted to acetic acid by aldehyde dehydrogenase. The first enzyme is alcohol dehydrogenase and second one is aldehyde dehydrogenase. Many people of Asian descent as well as Native Americans have a functional polymorphism in the aldehyde dehydrogenase gene that affects ethanol metabolism. The result is flushing of the skin and sensitivity to the ethanol, and these people cannot naturally take alcohol. There is a natural aversion. If they take, they get this reaction. Acetaminophen. Acetaminophen is a widely used analgesic and is regarded as a safe medication with a large therapeutic window. Toxicity may be seen in the setting of suicidal overdose or an accidental administration to children by mothers. Toxic dose is greater than 15 gram. Acetaminophen is metabolized in the liver. Various major metabolites include inactive sulfate and glucuronide conjugate. These are eventually excreted by the kidney. The amount of acetaminophen processed by the liver is only very small by the enzyme cytochrome P450, and it converts the toxic metabolite N-acetyl parabenzoquinone imidone NADPQ1 A small amount of acetaminophen is processed by hepatic cytochrome P450, resulting in the toxic metabolite NAPQ1. At usual doses, NAPQ1 is detoxified rapidly by the liver and excreted by the kidney. The toxic dose lead to excessive NAPQ1 accumulation. If the person takes a lot of paracetamol, acute symptoms include vomiting, diarrhea. Antidote is N-acetylcysteine NAC, given 10 hours within 10 hours of the intake of paracetamol. There is irreversible damage to the liver within 48 hours of overdose, including centrilobular necrosis, which causes a gross nutmeg pattern. As the liver fails, patient will exhibit jaundice and hepatic encephalopathy. The specimen picture shows the overdose of acetaminophen 15 gram. That means more than 30 tablets of 500 milligram lead to centrilobular necrosis in the liver, creating a nutmeg pattern. If the disease is not rapidly treated, the overdose is lethal. Arsenic. Arsenic is still used on occasion as a homicidal poison and in some countries as chemotherapy for leukemia. It's a poison dating back to ancient times. Arsenic is found in wood, preservatives and electronics. It is tasteless, odorless and is absorbed by the gastrointestinal tract. Toxic dose is as little as 200 milligram. It inhibits alpha-hydryl containing enzymes. Death is low in arsenic poison and it's a painful process. In one large fatal dose, symptoms are gastrointestinal tract. Symptoms begin within 30 minutes after ingestion with vomiting, rice water diarrhea, garlic breath and dry mouth, possibly with metallic taste. Small dose of other long-term lead to transverse white band in the fingernail called meseline, pancytopenia and neuropathy. Fingernail meseline, pancytopenia and neuropathy. Cyanide poisoning. Cyanide causes deadly hypoxia by combining with the ferric iron atom of the intracellular cytochrome oxidase. Cyanide may be found in most chemical laboratory. Minimal lethal dose is 200 milligram. There is a distinct almond odor during autopsy, which is only detected by a portion of the population. Other autopsy findings include bright cherry red, lividity, and hemorrhage into the stomach. When inhaled as a gas, it can take only minutes to cause death. Used in death camps during World War II. Cyanide poisoning has an almond smell to some people and causes hemorrhagic gastritis. This smell can be detected only by a few people, that means a few doctors who do the pathology. Lead poisoning may arise from various sources including lead paint, lead gasoline, and lead plumbing. Lead is absorbed through the GIT in infants and children who show greater absorption rate. Absorbed lead is taken up in bone, developing teeth in children. Lead line along gingival surface and soft tissue. Toxicity causes cognitive retardation, neuropathy, renal toxicity, anemia, and fatigue. Pesticides, organophosphates like parathion and malathion. The most widely used pesticides are organophosphates. They are parathion and malathion. Excessive respiratory exposure causes irreversible inhibition of cholinesterase. The sludge syndrome may develop in case of toxic exposure. Salivation, lacrimation, urination, defecation, gastrointestinal tract distress, and emesis. Accumulating acetylcholine inhibits the intercostal muscle, leading to respiratory failure and death. The antidote is pyrrolidoxime chloride. Paraquat. Paraquat is a commonly used weed killer. Excessive exposure causes pulmonary edema, hyaline membrane, and may cause interstitial fibrosis. End-stage disease is pulmonary fibrosis, called honeycomb lung. Trauma. Mechanical trauma includes blunt force, sharp force injury, strangulation, and firearm death. Blunt force injury may be caused by assault, motor vehicle accident, crushing accident like work-related, and falls. Characteristic features of blunt force trauma include the following: abrasion like scrapes or the denudation of the superficial epidermis. Usually they do not cause a scar. Contusion or bruises are the damage of the small blood vessel causing bleeding into soft tissue. Lacerations are caused by stretching of the skin, leading to irregular tearing with underlying soft tissue bridge. Then fractures of the bones are a sign of forceful impact and may be simple, clean break, or compound like piercing of the skin. Sharp object injury includes stab wound and incision. Stab wound is deeper than its width. An incised wound is longer than its depth. Strangulation may be manual with hands or by ligature and is caused by compression of the neck blood vessels, which causes cerebral hypoxia, leading to unconsciousness and death. Firearm death are usually related to homicide or suicide. Entrance wound tend to have an oval defect surrounding rim of abrasion. Exit wounds have a lacerated appearance. Burns. Burns are categorized by the source. Flame, direct contact with the fire. Contact burns, direct contact with a hot object like teapot. Radiant heat, indirect contact near a heat source like fire. Scalding, contact with hot liquid. Chemical, due to contact with the reagent that damages skin. Electrical burns, contact with high voltage source. And radiation burns due to contact with radiation source like sun. Burns can be partial or full thickness and are staged as follows: first degree burn, where erythematous skin base without blister. Second degree burn, blister formation sparing the dermis. Third degree burn, destruction of the epidermis and dermis. Severity of the burn depends on the stage and body surface area involved. Greater than 50% involvement indicates poor prognosis. Patient should seek medical attention if the burn is third degree, like painless and charred, and if it is larger than the palm of the hand, if the patient has inhaled smoke or is in shock. Inhalation injury can also occur along with the burns, like resulting from inhalation of soot material, and this can lead to laryngeal edema. People who are caught in fire may also suffer carbon monoxide poisoning, which can also be fatal. Electrical burns tend to appear as an erythematous lesion with blister formation or as charred white lesion. Deaths by electrocution are rare. Nowadays there is tripping occurs in the electrical connection due to circuit breaker, and most of the electric shocks are due to accidental and unintelligent use of electrical apparatus. Ventricular fibrillation occurs at 75 to 100 milliamps. To determine amperage, the following equation can be used. Amperage is equal to voltage by resistance. Histologic examination reveals vacuolation of the stratum corneum, vacuolization of the stratum corneum, and streaming of the nuclei. Forensic pathologists suspect a diagnosis of electrocution if person suddenly collapses, yelling profanity, and is found next to electrical equipment. High intensity currents such as lightning can produce fluorescent pattern on the skin, like what is called Littenberg sign. Radiation may cause hyperthermia and burns. Infants and elderly are at greatest risk. Ionizing radiation causes DNA damage by cross-linking DNA strand and generating oxygen-derived free radicals, which lead to double-stranded DNA breaks. Effects of radiation depend on the following. Dose rate: a single dose can cause greater injury than fractionated doses because of widespread damage. Cell division: rapidly dividing cells are more radiosensitive, like hematopoietic cells, gastrointestinal epithelium, endothelial cells, squamous cells, and lymphocytes. Radiation field: a single dose to the whole body is more lethal than the regional dose. Complications of radiation include fibrosis and carcinogenesis. Fibrosis leads to scarring and loss of function. Carcinogenesis includes the increased risk of skin cancer, leukemia, osteogenic sarcoma, and lung cancer. Clinical correlation: heat stroke. Hyperthermia is defined as rectal temperature 40.4 degrees Celsius and above. When the body cannot compensate by heat loss, heat stroke develops. Clinical manifestation include hot, dry skin, altered mental status, hypotension, tachycardia, and hyperventilation. Heat stroke is usually seen in the young or elderly after exertion in high temperature. Hoped that this session was useful to you. The next session will be about cell injury, adaptation, and death. Goodbye from ACPGMAT. Please visit the channel youtube.com/ACPGMAT for similar sessions. Thank you.